So thank you, members, and I now declare the meeting open to the public online, and I welcome all members who are participating by video conferencing. I also remind members about the protocols regarding the use of electronic devices. So are members aware of any apologies today, or Clerk, do you have any apologies?
I've received none, Chair.
Okay. Members, any apologies? No, nothing been indicated there. Okay, thank you, members. Moving on then to Chair's business. I just wanted, I suppose, to report back to committee that we did receive, I think it was probably Party Health spokespersons, received a briefing from Cathy Jack, the Chief Executive of the Belfast Trust last week, around pressure on staff and services. And I think that's an issue of huge concern, I have to say, particularly for staff who are being redeployed and all of the difficulties that we're aware that creates. So I just would, I suppose, extend our thoughts to all those staff who continue to operate in very, very difficult circumstances. And it's clear that continues to be the case. And I think it's important that that members bear that in mind, and indeed the public. It's clear that pressure remains on staff. The other thing I wanted to touch upon was just the fact that we did an informal meeting with foster carers in relation to our consideration of the Adoption Children Bill. And I would like to warmly welcome Maria McElgorm as the Chief Nursing Officer, who has been appointed. There was an announcement late yesterday. So just to welcome Maria to what is a very, very crucial post within all of the provision of health and social care. We're acutely aware of the strains and stresses on nursing. We're acutely aware as a committee, I think, of the need to not only recruit, but indeed retain nurses at this particular time. And I also think that we would certainly look forward to working with Maria as a health committee in relation to workforce planning. I think that's a crucial issue that we would like to see more detail on and to work with Maria and the department on in respect to that. But I want to wish her more in that important role. Very much good luck. The final thing I just wanted to touch upon. Sorry, did I hear something there?
It was just on that point about the Chief Nursing Officer, that point that you made there. I know I had asked the Minister for as an Assembly question, but the Chief Nursing Officer is paid significantly less money than the Chief Medical Officer. And, they're in charge of their respective professions. And I think it really does speak to the very core of a long-term sort of inequality that there is between doctors and nurses. And I think that it might be something that might be nice just to maybe for the committee to seek some clarification from the department to see is there an opportunity to review that, because I think it speaks to maybe some more inequalities beneath the surface there. And it just, I remember from getting the result or the information back, it is a considerable difference. It's not a small difference, it's a considerable difference, but yet they're very much both important and almost equal roles.
Yeah, certainly that is an issue. Would committee be content to be right to the department, seeking them to underline and to set out the situation, explain the rationale, and explain what progress is being made to ensure that nursing is treated on an equal basis with all the professions, given its central importance. Yeah, so members content with that. The other item that I wanted to flag up to committee just was what I believe it would a very important all-party group on cancer yesterday, and I will bring Paul in. I know Paul is the chair of that all-party group. We had a briefing yesterday around secondary breast cancer. Hugely worrying issue, I have to say. There's very limited information, and this is in common with some of the other things we have identified in terms of the data and not having the correct data. There's also issues around specialist nurses and access to specialist nurses, and issues around NICE as well. But it's a very, very worrying. It obviously impacts very, very hard on women. It's an extremely difficult condition, and I think we do need to know more about it. So I think that's something that we certainly should be supporting. And the information was very useful, and I want to thank the all-party group for providing the session. I know Colin was at it as well, and Carol was at it. Paula, go ahead.
No, thank you, Chair. And I know the ladies who presented yesterday will be pleased that you raised it today. I think all of us have received correspondence from constituents who have been affected by this, but it was a very powerful session. And I do think that we should be writing to the Minister just to reinforce their message. I know a lot of us maybe have submitted assembly questions written, but I don't think we really understood the impact that it has on the women and what can be done to improve them or improve the lives of women in their situation until we heard firsthand yesterday. So thank you for coming along, and to the other members who were there. It was a great session, and there's certainly work to be done around it.
Yeah. Does anyone else who's in attendance at that want to say anything? Or okay, thanks, members. Okay, so moving on then to the draft minutes there. I refer members to the draft minutes of the meeting of 13th of January at tab 3.1 of the pack. Are members content with the minutes? Yeah, members content, thank you. I also refer members to the minutes of the meeting of 18th of January, which are at tab 3.2 of the table pack. So that's Tuesday's meeting there at tab 3.2 of the table pack. Are members content with the minutes? Yep, members content. Thank you. And there are no matters arising from those minutes, members. So we're now, members, moving into a closed session consideration of amendments on the Adoption and Children Bill. So I'll just check back with the clerk. Can you confirm, clerk, when you have took us into closed session, and we'll take that consideration?
Thanks, Chair. I'll just let you know as soon as I receive confirmation that the streams have been turned off. Okay, Chair, that's us live and ready to go.
Okay, thank you, clerk. And can I just check that you can hear and see me okay?
Yes, I can hear and see you okay. In relation to the next item, Chair, we're just waiting on Niall Donnelly to come into the call, but the rest of the officials are there and available.
Okay, so members, then we're restarting then our session in relation to a number of SRs. So the next three are statutory rules relating to coronavirus, which were deferred from last week. Officials are available for any questions members may have on the SRs 348 and 349, and I do have just some questions on that, so I will go to the panel. Just check we still don't have Niall, clerk, is that correct?
Not at present, but the rest of them are on, Chair.
Okay, thank you. So we go firstly then to David Hughes, and David works within the health protection team in the Department of Finance. David, can you hear me okay?
Yes, thank you.
Yeah, and we're hearing you, David, thank you. Richard Duffin, who's Deputy Principal in the Department of Health. Richard, are you able to hear us okay?
Yes, I can hear you, Chair, thank you. Can you hear me?
Thank you, Richard. Yes, we're hearing you there. Thank you. And Peter Looney, who works within the Executive's COVID-19 Task Force, COVID Recovery and Strategy. Peter, can you hear me okay?
Yes, I can, Chair. Thank you.
Thank you, Peter. And we are joined also by Niall Donnelly, who is Deputy Principal in Health Protection Branch within the Department of Health. Can you hear me okay, Niall?
Yes, Chair. Can you hear me okay?
Yeah, hearing you. So listen, thank you all for attending and for addressing any questions that members may have in relation to these. So mine is really in relation to SR 348, and there has been, I think, so this is the one that providing proof that you're exempt from wearing a face covering. There has been a lot of speculation about this, and that how workable the rule is, etc. So. The rule is in front of us today, but have there been concerns raised around how workable this rule is, and have you picked up on that concern, and what do you have to tell us in relation to it, Niall?
If I could take that one, Chair. Yes,
go ahead.
there have been concerns raised about it. This policy was brought in order to try and strengthen the arrangements for face coverings. It has always been the case that face covering compliance is an important intervention in relation to trying to mitigate the spread of the virus. High levels of face covering compliance are necessary to get the full benefits out of face coverings. It's one of those areas where, as compliance drops, the benefits drop more rapidly. So whenever we were responding to the Omicron challenge in December, a number of measures were brought forward to try and strengthen the arrangements. So we have the legal duty on businesses to try and take reasonable measures to promote face covering compliance. But in order to try and ensure that as many citizens were using the regulations properly and not choosing to opt out, we looked at the proposals that are in front of you now, which were to require anybody who was relying on an exemption, a medical exemption, to provide proof of that. Recognise the challenges around that in terms of not wanting anybody to disclose personal sensitive information. And for that reason, we believe that the best approach to that would be some sort of a template letter, which would be issued by a GP, and which would simply confirm that in the GP's opinion, the individual met the criteria. Obviously, whenever we then did further engagement with GPs and the board, they highlighted some challenges around that, not least challenges that they were having around workforce planning. And they also flagged up challenges around, we believe that the number of people who would be genuinely entitled to rely on the exemption should be relatively small, but the GPs rightly pointed out that they would be inundated with people who believed that they were entitled, and that could be an issue whenever they were focused on a number of other high priorities like the rollout of the booster campaign. So for that reason, we asked ministers to extend the grace period for this particular provision, and we basically went back to the drawing board to see, well, what alternatives are there? We looked at the model that applies in Scotland, which is essentially a form of online self-declaration where somebody would go in, they would look at the guidance around what exemptions are, and if they were satisfied that they met them, they would confirm that by ticking a box, and they would then get a card issued that they could use. We spoke to the disability sector, and the disability sector actually held a forum where they invited their members in to talk to us about this. And they thought, they certainly didn't speak with one voice, but they thought that there was certainly merit in that, because it allowed people then to not have to have perhaps difficult conversations with bus drivers or people in shops, and they can just produce this rather than having to explain where they were exempt. I think there's a balance to be struck. I think we need to decide whether that solution will go as far as we wanted to do in delivering the more robust enforcement, or whether it's more appropriate to sort of leave the statutory duty in place, but to revisit whether or not we require people to provide proof of exemption. There is a paper before the executive today, so it will be discussed further today, and I suspect that we will be back in front of the committee in due course. I can't elaborate any further at this stage, but I can say it is under active consideration because of the challenges that have been highlighted to us.
So to be clear then, you're asking the committee to consider a bill which you haven't fully considered yourself. Is this likely to be moved even in its current form, or is there more potential that it's likely to be either amended or revoked and amended? So how are you taking it forward in that sense, Peter? Or how are the department taking it forward?
I think that it is likely that we will need to amend the regulations to take account of what we have uncovered as we've tried to implement this policy. It is absolutely the case. I think from an official point of view, had we been developing this policy at normal speed, I think we would have had more time to do due diligence, and we would have anticipated some of these issues. But we were working very fast in response to Omicron, and I think we would readily put our hands up and say that we probably didn't have a full understanding of the issues at the time that we asked the executive to agree to these changes. It is regrettable, absolutely regrettable, that we're doing this now rather than beforehand. But I think the engagement that we've had with the disability sector has been really useful in helping to inform the process.
And are those engagements ongoing and with sectors? Other sectors, so there's ongoing work on this. Okay, Pam, go ahead. Yeah, Pam.
Thanks, Chair. Just took a second for the system to let me unmute there. Yes, and thank you to the panel, Peter in particular, for that. I was going to say clarity around the situation. It's not quite clarity, but it's getting closer to clarity, I suppose. I suppose from where we are now, and we all understand the issues around compliance of face coverings and the challenges that has brought, and we can see. We can all physically see the compliance dropping within the community, and we understand why that is as well. But there are very genuine cases of people out there who, for physical and mental reasons, cannot wear a face covering. So I think it's really important that they are protected. So that clarity and the talk around how it's done in Scotland is very useful. I'm just wondering, given where we are in the pandemic, and I understand a month ago we weren't really sure what impact Omicron would have. Thankfully, it seems to have almost had, in pandemic terms, a positive impact, and hopefully we are seeing the start of the end. If we can't go any further than that at this point of this pandemic, and that's really welcome. So I'm just wondering about, in terms of the timing now, surely now events have overtaken where we are now, and I'm not even sure that it's appropriate to be supporting this type of legislation at this point. I understand maybe preparing legislation to have in the background in case you would ever need it again, but I'm not sure that it's now appropriate with where we are in time. And I do fully appreciate the difficulty that this emergency legislation has caused, and we all know that legislation should not be made in this way, in this format, and at this speed, because this is where you see the gaps and the holes and all the problems that come from that. So I suppose my direct question to you, I don't know whether you can answer or not, is should we not be abandoning or delaying this particular amendment at this point, given where we are in the pandemic?
I think, Pam, you're absolutely right in what you're saying about the journey with the Omicron variant and how it has developed, and health colleagues are probably much better placed than I to talk about that. The transmissibility of the Omicron variant, I think, makes the need for face coverings probably more important even than it was with Delta. I know that the severity of Omicron appears to be less severe than the Delta variant, but it is more transmissible. So face coverings are important, and that's why, in relation to the instrument that's before the committee, things like the duty on businesses to try and promote compliance within their settings is really important. And through that, what we mean is things like signage and messaging, systems in place to try and make sure that face coverings are worn. I wouldn't want this issue around the proof of self-exemption to detract from the wider changes. I hope that we will resolve the self-exemption part very, very soon, and we'll come back to the committee with an update on that. But I think it is important that the measures which are in place around the duty on businesses continues in place. Face coverings were a baseline measure. The legal requirement to wear face coverings was a baseline measure in the autumn-winter plan, and I expect that those baseline measures will remain in place during the autumn-winter period. The executive does review all restrictions on a 4-weekly basis, and the next review is due on the 10th of February. And I think at that stage, the executive will be keen to review all the restrictions that remain in regulations and in guidance to give a clear position on how they want to move through the into the spring.
Okay, thank you. Thanks for that, Peter.
Jerry, go ahead.
Thanks, Chair. Thanks, Peter. I said this in the last meeting, but I've serious concerns about the burden this places in front of people with disabilities. People have been in touch with myself, I'm sure others as well. People who are deaf or their hearing is impaired, people with autism. And I find that obviously everybody should be wearing a mask unless they have medical reason not to. I made that clear throughout the pandemic and still do, even when others have kind of ignored that message. But I'm really concerned about the impact this will have on people who have disabilities, who are marginalised, and you touched upon it yourself, Peter. We obviously have a bit of a crisis, to put it lightly, in our GP services. So somebody who is exempt, has disability, the onus on them is to go and seek a letter from a GP. I think is laden with massive problems, obstacles, barriers, and therefore they would be denied access to certain or face a fine in certain instances. So for me, that screams massive problems around discrimination, around isolation, and that. So just to make that political point, you can respond to that if you want. But the second point around, so you said there was a format for uploading information. Is that a website? Is that an app? And is that developed, or what stage is that at the minute?
No, we have scoped out what that solution would look like if it was to be taken forward, and there would be different ways to implement it. The Scottish model is really quite simple. You go onto a website, it presents you with the guidance around face coverings, and then you tick a box to confirm that you have read and understood the guidance. You then just can generate a card or a piece of paper yourself, which has that proof of exemption on it. It is still a form of self-exemption, a self-declaration. So therefore, people who want to game the system will still be able to game the system, and that's why I think we need to decide whether that model is worth the investment if it's not going to deliver fully on the policy objectives, and those are the issues which we're working very closely with the disability sector on at the minute. We want to try and make sure that we have whatever solution we put in place, we need to be responsive to the kinds of scenarios that you've outlined. I mean, it's clear that many people have genuine reasons for not wearing face coverings, and we need to make sure that we don't set the bar so high in regulations that genuine cases can't avail of the exemptions. There's a bit more work to be done. I do suspect that we will draw it all to a close very soon, and it may be that even by next week we'd be able to come back to the committee with an update on where we've got to on it.
Okay, Jerry.
Yep, thanks.
Thanks, Jerry. Okay, and then Peter, or indeed any of the rest of the panel. Peter, you had referenced there that this is likely to be discussed at the executive today, and I know there appears to be an awful lot of speculation out there in the media around the executive today. You nearly think it has already taken place, to be quite honest, which is a bit strange. But anyway, so as a result of that discussion taking place today, is there a possibility that one of the outcomes would be that this motion, that this SR would not be moved until further work has been done?
I believe that hopefully after the executive meeting today, we will have the clarity about what the new arrangements should be. I think that there may be a need to come back with a further amendment to the face coverings regulations, but I think that a number of the provisions which are contained in it will remain extant. So it's not that we're saying that the instrument isn't going to be required at all. I think we probably will just do some amendments to some of the discrete provisions. It's difficult. If I was having this conversation with you tomorrow, Chair, it would be much easier.
Yeah, and I think, and I have to say, I suppose my concern would be, I do believe face covering and adherence out there in the community to face coverings is a really fundamental, important measure in terms of the overall, and probably will be, until such times as we move out of this. So all this uncertainty in some ways at times undermines it, and you tend to see that out in the community. So that's regrettable. We're also hearing an awful more work to be done, need to decide, discuss further today. We'll draw to a close very soon. Developing policy, didn't have a full understanding. So you can clearly see. But listen, thank you all for coming. We have given the members the opportunity to question there. The committee can go forward into considering how we might move forward in relation to this bill, given all the issues that I've outlined and other members have outlined there. So I'll just double check with the clerk that there's no other members looking in for a question with officials, and then we'll allow the officials to go and we can go back to our consideration. Clerk, anybody else?
No, Chair, no further indications.
Okay, so listen, everyone, thank you for your attendance today. We appreciate you taking the time and briefing and answering members' questions. Thank you. Okay.
Thank you, Chair.
Okay, members, just give a wee second there, and we'll come back to our sort of more formal consideration. And I think just will grab the gallery view. So, members, I think there is clearly work ongoing in relation to this, and that does give me a little bit of concern that we would be potentially signing off on something that hasn't been fully engendered. I'm wondering, and I will check with the clerk, but I'm wondering, should we consider looking at not taking a position at this point in time, but standing ready as a committee to come back on a single issue basis should the clarification be available to look at it. But at this point in time, given what we've heard, not taking a position in relation to this SR at this time, it's very clearly not fully ready. So just wondering what members' views would be on that, or any other comments or suggestions.
Yeah, Chair. Sorry.
Paula, so I'll take Paula, and then I do see I had hands up from Colin and Pam, but I'll take Paula now. Yeah, go ahead, Paula.
Thank you, Chair, and thank you to you and others for the questions that were along the lines of what I was going to ask. But I fully support your suggestion that we wait for that clarification and that further work. Thank you.
Okay, so Colin.
Yeah, Chair, I just agree with that. I think it's actually really important that we delay on the basis that, we would be sending out a message to the public that we have in front of us something that is flawed and has problems, and we can't we can't accept, but then we would go ahead and approve it. I think that would send out the wrong message. And if it does mean us coming together for 10 minutes on Monday to actually say, right now, we've got the clarification, we can approve it, I think that is the thing to do, just to make ourselves look like we're professional at what we're doing.
Yeah, thank you, Pam.
Yes, Chair, I wholly agree with the sentiments made there. I think at where we are with this, I think we cannot be seen to be approving that particular reg in this fashion. So I would fully support delaying, putting off any decision at this point. Although I would say, to Colin's point there, we need to apply that logic to all of the legislation that we are dealing with at this point in time.
Thank you, Pam. And Jerry, is that hand up again there from you?
Yeah, just agree, Chair. Just agree. Yeah, I mean, I think no disrespect to the officials, but the SR is pretty half baked, and we can't be agreeing that when it's going to change and stuff's going to be added or subtracted from it. So I would agree on delaying.
Yeah. Okay, thank you, members. So I'll go into our formal consideration then, taking that into account. So in terms of SR 2021/348, I refer members to papers at tab 7 of the pack. The Examiner of Statutory Rules has not yet reported on this SR. The rule is due to be debated, so putting this formally, the members, this rule is due to be debated in the Chamber on Tuesday, and this is the last opportunity for us to formally consider the rule. I would suggest that based on the lack of information, that we take no position at this time, but stand ready to reconvene to consider updates or amendments and to consider the rule in light of further information. Would members be content? Yeah. Thank you, members. Okay. Clerk, I'm just checking if that's clear enough for you in that sense.
Yes, sure, that's grand. That's grand on 348, yeah.
Yeah. Okay, and members therefore content that we are not taking a position on the rule at this time. Yeah, thank you. Okay, so moving on, I move on then just to the next SR, Clerk, isn't that correct? That's the completion of that one? Yeah.
Yes, that's correct, on the 349.
Yeah, thank you. SR 221/349, members, is at tab 8 of your pack. You will recall this SR was considered at last week's meeting, and the committee agreed to defer its consideration pending corrections from the department addressing drafting errors. So there were correction slips to be forwarded, if you recall, members. The correction slips have now been received and are at tabs 8.1 of the pack and 8.5 of the table pack. The Examiner of Statutory Rules has not yet reported on this SR. Do members have any further issues they want to raise in relation to that one? The correction slips are in? No. So therefore, can I ask members to agree formally? Can I ask members to agree formally that the Committee for Health has considered SR 2021/349, the Health Protection Coronavirus Restrictions Regulations 2021, Amendment number 21, Regulations 2021, and subject to the report of the Examiner for Statutory Rules, recommends that it be approved by the Assembly. Are we agreed? Agreed. Thank you, members. And members, moving on then to draft SR 2020 Extension of Powers to Act for the Protection of Public Health, NI 2021. So, in relation to this one, members will remember the committee was briefed by the department on the policy proposal. So that was SL1 stage for this SR at our meeting on the 25th of November, and requested further information from the department in relation to it. Due to drafting errors, the department relayed the SR last week, but the committee agreed to defer its consideration until a response to the request for further information was received from the department. Members, a response from the department was received late yesterday afternoon and is included at table pack at tab 9.7. The debate on this rule has also been rescheduled to Monday the 31st of January, members, and therefore we are able to defer consideration of this to next week to allow members further time to consider the response. So I'm very aware that members only got this in at 4 o'clock yesterday afternoon, so we have an additional week. Would members be content to defer consideration of this SR until next week? Yeah, members content. Pam, go ahead.
Yes, Chair, definitely content to defer it until next week, and would like an opportunity to ask officials some questions on it as well. I mean, I do note that the letter outlines has a table basically, and it outlines, you know, which some of the powers that have been used and some of them that haven't. But I also note that some of the powers are just left blank. It doesn't say whether they've been used or not. So I think we would have further questions on this, and I think it would be appropriate to have officials back to answer those questions.
Yeah, committee content with that, and clerk content that we'll seek officials for that. Yeah, yep. That's fair enough. Okay, so we're deferring consideration of that. Thank you, members. So moving on then, members, to the next group of SRs, which are related to travel. And we do have a department official here today to brief the committee on the regulations, and then, as usual, we will go to formal consideration of those. So I'd now like to welcome Carol Picton-Linus, who works within the International Travel Restrictions Directorate. I'd just like to check, are you able to hear us okay, Carol?
Hello, Chair. Yes, I can hear you. Thank you.
Hi, Carol. So we are hearing and seeing you there, and thank you very much for that. So, Carol, do you want to go ahead and brief, and then we can take some questions from members? Thank you.
Okay, thank you so much. All right, then. So thank you very much for the invitation to attend today's meeting of the committee. Committee is considering 5 statutory rules today, which have been made as a consequence of the emergence of the Omicron variant of concern and the review of the introduction of these temporary measures on 5th of January this year. If I may make an overarching summary of the suite of regulations the committee may wish to consider today, they are SR 2021 number 322, number 323, number 340, number 343, and SR 2022 number 3. This suite of regulations aligns with the UK government and the other devolved administrations in relation to border health measures in respect of international travel and to the Omicron variant. If the committee is content, I will briefly summarise each set of regulations in the order in which they were made. So the first SR is number 322, the Health Protection Coronavirus International Travel 2021 Consolidation Amendment number 11 Regulations, Northern Ireland 2021, and they came into operation on the 6th of December. These regulations made changes to the Health Protection Coronavirus International Travel Regulations, and they were made to add Nigeria to Schedule 1 of the principal regulations. That's the schedule that deals with the red list countries, and also add Nigeria to Schedule 8, which is a prohibition on arrival of aircraft and vessels, which prevent aircraft and ships from the red list countries arriving in Northern Ireland except in limited circumstances. SR 2021 number 323 were the Health Protection Coronavirus International Travel Operator Liability and Information to Passengers Amendment number 11 regulations, and they came into operation on the 7th of December 2021. These regulations made changes to the Health Protection Coronavirus International Travel Regulations 2021 and the Health Protection Coronavirus International Travel Operator Liability and Information to Passengers Regulations 2021. And these regulations were made to amend Regulation 4 of the Principal Regulations in relation to the timeline for completion of the passenger locator form to require that passenger information must be provided 48 hours before arrival in Northern Ireland. This amendment was brought forward to align with the UK Government and DA's timelines for completion of the PLF. Regulation 4 required that passenger information must be provided either on or in the 48 hours before arrival. So this amendment just removed the provision to complete the PLF on arrival. They also required all individuals aged 12 and over travelling to Northern Ireland, including the fully vaccinated, to take a pre-departure test. Individuals would then need to provide proof of a negative COVID test taken within 2 days of departure to Northern Ireland. They also required the age from which red list arrivals are required to possess notification of a negative coronavirus test upon arrival in Northern Ireland, i.e. a pre-departure test, will also increase to 12 years and over, in line with those pre-departure test provisions applying to non-red list arrivals. They also provide that enforcement of self-isolation can apply to children who fail to comply with the self-isolation rules, irrespective of whether they have arrived from a red list or a non-red list country. The regulations at that time provided for enforcement of self-isolation for children that had arrived from red list countries only. They also amend the schedule to the operator liability regulations to update the information which operators must provide to passengers arriving in Northern Ireland. Moving on to SR 2021 number 340, the Health Protection Coronavirus International Travel 2021 Consolidation Amendment number 12 Regulations 2021. These came into operation on the 15th of December. And these regulations made changes to the Health Protection Coronavirus International Travel Regulations 2021. And these regulations were made to remove all the South African countries listed on Schedule 1, the red list countries. We've not removed the red list itself, it just simply doesn't have any countries on it at the moment. Chair, do you want me to cite all the 11 countries that were removed, the South African countries?
No, I don't think that's necessary, Karen.
Okay, thank you. And similarly, we removed the flight ban and the prohibition of arrival of aircraft and vessels for those countries as well. So moving on to SR 2021 number 343, the Health Protection Coronavirus International Travel 2021 Consolidation Amendment number 13 Regulations 2021. These regulations came into operation on the 16th of December. And these regulations made changes to the Health Protection Coronavirus International Travel Regulations, and they were made to permit those red list passengers who are isolating in accordance with Schedule 7, that's a managed isolation schedule in relation to red list arrivals, immediately before 4 a.m. on the 15th of December 2021. And that's when we removed all the countries from the red list. And that they were able to complete their period of self-isolation at a place other than the place specified in their managed isolation package. So the final set of regulations were made SR 2022 number 3, and they are the Health Protection Coronavirus International Travel Operator Liability and Information to Passengers Amendment Regulations 2022, and they came into operation on the 7th of January. And these regulations made changes to the Health Protection Coronavirus International Travel Regulations 2021 and the Health Protection Coronavirus International Travel Operator Liability and Information to Passenger Regulations 2021. And following the identification of the Omicron variant in late November 2021, UK ministers agreed precautionary measures to slow the spread of the variant, recognising that it was not possible to prevent its incursion. And at that time, ministers agreed to include 11 African countries onto the International Travel Regulations red list and required fully vaccinated arrivals, which accounted for 95% of international arrivals into Northern Ireland from non-red list countries, to undertake PDT before travelling, pre-departure testing before travel to the UK, to self-isolate for 10 days and to undertake day 2 PCR testing. At the time the measures were announced, it was stressed that they were to be temporary in nature and would be subject to review. On the 14th of December, it was agreed that all countries would be removed from the red list and that the remaining temporary measures would be reviewed on the 5th of January with a view to lifting the pre-departure testing requirement as a minimum, depending on the extent that the Omicron variant was prevalent throughout the UK. So following the review on the 5th of January, the main changes made by these regulations are to undo the temporary Omicron measures that were applied to eligible non-red list arrivals, i.e. the fully vaccinated arrivals from non-red list countries. So these regulations then remove the requirement for eligible non-red list arrivals to undergo pre-departure testing and to revert back to the alternative Lfd regime for mandatory day 2 post-arrival testing. And if the committee will recall, this regime came into operation under SR 293 with effect from the 31st of October 2021, and these regulations were considered by the Health Committee at that time. These regulations also supplement the enforcement and information sharing regime to ensure that there are powers to deal with those who do not comply with these rule changes. They also remove the obligation to self-isolation for eligible non-red list arrivals. They also update the list of recognised vaccines and include 16 countries in the fully vaccinated rollout policy, and that came into effect on the 10th of January. Finally, they update the information that must be given to passengers travelling to Northern Ireland in relation to new measures. So that's the 5 regulations that I've briefly covered for you. I'm happy to take any questions. Thank you.
Okay, thank you, Carol, and thank you for outlining that in the presentation for committee this morning. And I do recognise that, you know, these are in response to very fast-moving situations, and I fully support moving quickly to bring in regulations where necessary, and that indeed that they may not always be perfect and then need amended, or the situation may change and need amended before we've actually had a chance to look at the original. So I get all that. However, I suppose some of my questions are in relation to the issue of considering that those dynamics could return at a given time. So it's incumbent on us as a committee and a department to learn what we learn from those things and see how it could be done better the next time. So some of the questions are in that context. But I do understand that this is very, very difficult and that there's a lot of work going in to do that, and we do appreciate that. So in relation to the PCR, when it was the case that the PCR test had to be taken on day 2, I have picked up on a number of cases where people were arriving into Belfast and transiting into the 26 counties and were therefore not going to be here on day 2. And I'm just wondering, is that something that we need to consider going forward? And I understand a lot of these at times appear to be sort of almost cut and paste from what's happening maybe in England. However, we have particular challenges here. So I'm wondering, has that come to your attention? Is it something you have given thought to or could give some thought to as to how that might, because the effect of it was then people sometimes had to just change their travel plans and go to Dublin, and clearly we don't want people to have to change plans because the systems can't cope with their original plans into Belfast or whatever. We want to drive our own, you know.
Yeah.
So
what I can say about the day 2 PCR test, Chair, is that the regulations actually the regulations provide that a person can undertake the day 2 PCR test on or before day 2, so they could actually take it on arrival in Northern Ireland. So you know, if they're transiting through and they're here just for the one day and moving on, they could actually take it on that day. For the fully vaccinated, there is the alternative Lfd test, which, as you know, can give you a result within 30 minutes. So you know, so that if that sort of answers your question. So you don't have to wait 2 days before you can take the PCR test. You can actually take it any time from arrival up until day 2.
So you could take it on arrival, essentially.
Yeah. Yes.
If you were transiting to 26 counties. Okay, and that may deal with that. I'm not sure if that was clear actually to people, but that's another separate issue. But I think it's important in cases like that is made clear that people understand that.
The NI Direct guidance, Chair, sorry for talking over you. The NI Direct guidance does say that it can be taken on or up to day 2 of arrival.
Okay, thank you. Then moving on to the other part of the thing which you did identify then is around the Lfd testing. What's your assessment of the rigour of the Lfd testing at home? Because there are also, you know, anecdotal evidence of people, you know, not uploading tests or using, you know, other tests. Lfd is slightly harder to monitor in the sense that it's not in a dedicated centre. It can be done at home. Do you have an assessment, or how are you monitoring the effectiveness of that on given those dynamics?
Okay, well, the latest data that I heard from UK government there when we were looking at bringing in the Lfd regime in the first place was that they anticipated that the compliance would be around 60%. And I suspect, since we've had the Omicron variant, that compliance rate has increased, but I don't have exact figures to date, Chair. But I suppose in a way, in all honesty, you are relying on people to be honest and upload these tests. It's like with any test, and there, you know, we will be looking at the current and compliance rate, and also the issue of the confirmatory PCR test. That will give us an indication of you know, people submitting their responses submitting their test results and the issue of the booking of the confirmatory PCR test, which is a legal requirement for a person to do.
Okay, thank you. And it would be useful if there is information forthcoming, in terms of monitoring of that. It would be useful, I suppose, for committee to be able to see that. So thank you. So I have a number of members indicating. I'm going to go to them there now. At this point, I have Paula, Deborah, and Jerry. So we'll start with yourself, Paula. Go ahead, please.
Thank you, Chair, and thank you, panel, for the update this morning. My query was in relation to SR 2021-323, and it's under the purpose there around require an eligible non-red list arrival to Northern Ireland to have and produce evidence of a negative test result and to apply that requirement to children over the age of 12. I'm not sure whether things have moved on, but certainly we as elected reps in the run up to Christmas, when people were going to try and travel around Christmas time, I think people were struggling to be able to demonstrate proof of vaccine or other aspects for children within that 12 to 18 age group. So I'm just wondering, has that issue been cleared up as to how that evidence can be uploaded, etc., on the NI Direct website? Thank you.
Sorry, can you say that last sentence again? How we can do what, sorry?
Yeah, just through the NI Direct website in terms of having their own account. It's just for that age group, for minors, so to speak. For
them to undertake a pre-departure test?
Well, to upload it, for example, or to have a COVID international travel app to demonstrate their vaccinations certification. Just wondering, has that been cleared up?
So for Northern Ireland residents who are arriving back into Northern Ireland, from what I understand, the COVID app does not make provision for you to show proof of pre-departure testing. It's really to prove your vaccination for arrival. So from my understanding is if you're 12 and over and you undertake pre-departure testing to travel back to Northern Ireland, then you would have to show proof to the operator before you board the plane. So I'm not quite sure if that answers your question, Paula.
Yeah, no, I'm sorry, I said NI Direct website, I should have said gov.uk, that website. It was more just, so that, did it just show the actual, lateral flow test with the non-bar?
No, what happens if you, it's in the regulations, so you have to show proof that you have, you've got a negative result, so that would be in the form of an email that you get from the provider of the test. So that you show that email, or you show the, any correspondence that you have them, yeah.
So there's no requirement then for you to have the app. It's more just that email. Okay. Sorry. Thank you for clearing that.
Thank you.
Okay, Paula, is that you?
Yes, thank
you. Yep, Deborah, go ahead, please.
Thank you, Chair. I suppose these SRs and these rules seem to reflect, the full circle that we've travelled, pardon the pun, since the onset of Omicron. And really, I just have three questions just in relation to it. The first one is, are there any Omicron, just for clarity, really, for everybody, are there any Omicron Pacific restrictions still in place within the travel regulations, or do these rules represent the full return to the situation pre-December? And then, are there any plans to go further should the scientific and medical evidence show, the trends in transmission are now likely to drop significantly? And then lastly, my question just centres around, obviously, these travel regs were changing very quickly, and we all understand the reasons for that and why they had to happen. And what level of prior consultation do officials have with the industry prior to drafting of the regulations? Because I know there is wider concerns in terms of that industry and the stop-start approach to travel and tourism, and I suppose that's going to be for the executive to examine provision and support for those sectors for recovery. So it's just those three questions, Carol. Thank you.
Okay, if I can remember them. And so the first one is are these regulations a return to the pre-Omicron days? And yes, basically that's what the last set of regulations are doing. SR 2022 number 3. They are going back to where we were before the end of November, when the Omicron variant emerged. The second question was, remind me again, please, Deborah, was in relation to.
Yeah, it was just whether, we're likely to see further, sort of. If we're going to go further, if the scientific and medical evidence trends, we're showing that transmission is likely to drop further or significantly.
Yeah. Okay, so there is the UK government are doing a January review of the travel framework, if you like. They've done reviews in recent months. So they did one in June, they did one in October, and now we're doing one in January. And that was meant to take place at the beginning of January, but because of the Omicron variant, that's been pushed back. So there will be discussions and decisions made potentially next week on what the direction of travel will look like, if you like, with a view to considering what is proportionate, both from an economic point of view, in other words, your industry, and the public health perspective, with a view to looking to see, and also to consider we have now got the further rollout of the vaccination program and the booster program to see what is proportionate and safe. So there'll be decisions being taken next week, which will look at what we do about international travel in terms of looking at the vaccinated policy and those travellers who are unvaccinated, and also to build in contingencies should other variants of concern arise, and how we can ramp up and step down various measures. So that's coming in the next couple of weeks. So I'll be back in front of the committee again with potential regulations on that. And then finally, in terms of consultation with the industry, UK government have done a lot of industries and other travel industries, and we're minded to do similar once we know what that proposal would look like. Thank you.
Okay, thank you, Carol, for taking us through that.
Thank you.
Thank you. Yeah, and just actually as a sort of a follow-up to Deborah's question, which I think is a good one, and I do understand that, and you have mentioned the UK government there quite a bit, and I suppose, I fully understand that there may be times when that is convenient and appropriate, and that's sometimes easier in a sense, and that's certainly no issue with that. However, in addition to that, and particularly around the whole consultation, you did touch on it at the very end that the department here would do its own consultation with the sector as well, and I think that's important. But also we have the issue here of a small island and the need to have kind of common sense harmonisation where that can be done. So are you also in touch with the 26 counties in relation to that as to how it can be managed? Because we don't have to take them in a cut and paste fashion. We can make amendments that would maximise the opportunities, or reduce and coordinate our response better. So
yeah. I mean, obviously we don't just blindly follow the UK government on what they're proposing. Obviously, we consider what they're proposing, and then we obviously consider that in a Northern Ireland context to see how, whether it is safe and proportionate for us to do that. In terms of a direct consultation with the South, we haven't done that yet to date, but we are aware of. Obviously the Republic is part of the Common Travel Area, so we have that sort of negotiation with them in terms of what the Common Travel Area looks like and the travel measures in it. But obviously, as part of the Northern Ireland government, we have our own public health perspective on that, and what's safe for Northern Ireland. But I'm conscious that we do have a land border on that in that respect.
And in relation to that then, Carol, in relation to that then, have you inputted, or are you actively inputting into the January review that the British government is doing to indicate to them the particular challenges or difficulties or dynamics that we have here in terms of travel here? Yeah,
absolutely. We have officials meetings with the UK government, and we would put across the Northern Ireland perspective, both from a public health point of view, CMO, CSA advice, and what would be fit for purpose for Northern Ireland, and whether we're minded to align or reasons for not. So that's all part of the negotiations that are going on for the January review.
Okay, thank you. So moving on then to Jerry, and then I see Colin has indicated, so go ahead, Jerry, please.
Thanks, Chair. Thanks, Carl. Just a question in relation to number 3, amendment number 3, the last one, and I think it connects to one of the earlier ones that you presented as well. Just in regards to the change the requirement for people to have a negative test before they arrive here, and really what I'm kind of asking is, what impact will that have, or has it already had, or how is it considered to have on people still bringing the virus with them? I mean, obviously, they test 2 days after being here, if I've understood it correctly. There's obviously nothing to stop people picking it up in the airport, on a plane. So really, obviously, you don't want people to take a test just for the sake of it, but I would be concerned that that would lead to a further transmission of the virus, especially as it's airborne, and airplanes and airports are obviously quite prone to spreading. So, what's the kind of thought process for that?
Okay, well, in terms of SR3, if you've mentioned there, we removed the requirement for pre-departure testing on the basis that you've got the fully vaccinated policy now. You've got most people are fully vaccinated, and I think the public health advice or the public health logic is that the vaccination, and I'm no clinician, so I hope I get this correct. The vaccination doesn't prevent transmission in any way, shape, or form, but it does reduce the severity of people getting sick. So, as you quite rightly say, if you did a pre-departure test 2 days before you get on a plane, there's nothing to say that you wouldn't catch the virus actually as you're boarding the flight, for example, and then you're relying on the day 2 post-arrival test to pick up any infection. And then obviously the domestic sequencing will then help us to determine whether or not there's a variant of concern that we need to be worried about.
Thanks. Yeah, well, you kind of it didn't allay my fears, Carl. You kind of made them worse, because obviously, the vaccine is important in terms of reducing severity, but doesn't stop obviously the virus from spreading. So somebody could be negative on 48 hours before, 24 hours or 12 hours. Before flying, they could catch it, and then they could be spreading it within that 48-hour period. So I appreciate your answer, but it doesn't really give me any more confidence in the change. That's the correct one, but
But if you did have the pre-departure test, and you, as you exactly say, that would be the same thing. Somebody could test negative and then get on a plane and be infectious by virtue of being in the airport, if you like. The fact is that people are fully vaccinated, you'd like to think, and have boosters, so it would just reduce the severity of illness. You're not going to stop the transmission in that sense.
There's difficulty. There's a bigger time frame for that virus to develop and spread. But okay, thanks.
Okay, thank you.
Thank you, Jerry. Colin.
Thank you, Chair, and thank you, Carol, for your presentation. Carol, I know we've had an awful lot of information today, and there's quite a number of the SRs. I was just wondering, maybe just for clarity, then, if we take Europe, and the majority of countries are in the same status, if people from here travel over to Europe and then come back again, is it at this case that they're not required to do a test before they come home, and then when they do come home, somewhere up to 48 hours upon their return, they're required to do a lateral flow test? But just for clarity on that, is that a lateral flow test that you do at home, or is that one that's required to be purchased through a supplier? Because I know you said earlier it only takes a half an hour to actually do that test, but actually, as I understand it, have to request that, book that, and have those details for your passenger locator form before getting home. Is that still the case?
Yeah. So, Colin, the things you've just set out there apply to fully vaccinated arrivals. Yeah. So, okay, so the fully vaccinated arrival then no longer required to do pre-departure tests, and then will be required to undertake day 2 post-arrival testing either on or before day 2, which can be either a lateral flow test or a PCR test. The lateral flow test, yes, you would have to book that in advance. So if you book that in advance, you would like to think that it would be arriving at your destination before you get home, and there is scope to pick up these tests in the airport when you arrive. So you could do the test there and then if you liked. If that helps.
Okay. Perfect. That's grand. Thank you very much. Thank you.
Okay. Thank you.
Okay, thank you. And thank you, Carol. So that seems to be all of the members' questions there. So I'd like to thank you for coming along to committee today, and to just wish you all the best and take care in the time ahead. We'll go ahead and do our formal consideration.
Thank you very much, Chair. Thank you.
Thanks, Carol. Good luck. Okay, members. So we'll go through each of them in turn then. SR, first one is SR 2021/323. So, do members have any further issues to wish to raise in connection with that statutory rule? No, thank you. If not, then can I ask members to agree formally that the Committee for Health has considered SR 2021/323, the health protection, coronavirus, international travel, operator liability and information to passengers, Amendment number 11, Regulations NA, and subject to the report of the Examiner of Statutory Rules, has no objection to the rule. Are we agreed? Agreed, thank you members. SR 2021/340. I refer members to tab 12 of your pack. Have members any further issues they wish to raise in relation to the connection with statutory rule? No, thank you members. So then can I ask members to agree formally that the Committee for Health has considered SR 2021/340, the health protection, coronavirus, international travel, 2021 consolidation, Amendment number 12, Regulations 2021, and subject to the report of the Examiner of Statutory Rules, has no objection to the rule. Are we agreed? Thank you members. And SR 2021/343, which I refer members information at tab 13 of the pack. Have members any further issues they wish to raise in connection with statutory rule? No, thank you. If not, then can I ask members to agree formally that the Committee for Health has considered SR 2021/343, the health protection, coronavirus, international travel, 2021 consolidation, Amendment number 13, Regulations 2021, and subject to the report of the Examiner of Statutory Rules, has no objection to the rule. Are we agreed? Thank you members, we're agreed. SR 2022/3. I refer members to tab 14 of your pack. Have members any further issues they wish to raise in relation to this statutory rule? No, thank you members. Can I then ask members to agree formally that the Committee for Health has considered SR 2022/3, the health protection, coronavirus, international travel, operator liability and information to passengers, Amendment Regulations NA 2022, and subject to the report of the Examiner of Statutory Rules, has no objection to the rule. Are we agreed? Thank you, members. And members, the next so that deals with those amendments. Just check I've got them all there, Keith, as we went through them.
Yes, yep, that's great.
So members, the next two SRs then relate to tobacco retailing and smoke-free vehicles. You will recall that we discussed these pretty extensively at SL1 stage, so these are now coming back in SRs. So we have considered SL1 policy proposals for the regulations at our meeting on the 7th of October, and we were content that the rules be made. I refer members to the Clerk's memo outlining the provisions of each SR at tab 15.1 of the pack. We're now formally asked to agree each SR in turn. The SRs are subject to negative resolution, and the Examiner of Statutory Rules has not yet reported. An official is available if members have any queries on the issue, but this is the last opportunity for us to formally consider the rules. So just again to emphasise, these are the ones around people purchasing tobacco products for minors and also around the smoke-free vehicles. So do members wish to speak to officials or are content that we go to formal consideration? Content to think that we move on, yes. We've discussed them at some length, so and they're fairly well supported, I think, in terms of the committee's consideration of the SL1. So I refer members to tab 15 of the pack. This is in relation to SR 2021/326, Tobacco Retailer Fixed Penalty Amendment Regulations. So have members any further issues they wish to raise in relation to this statutory rule? No. Can I then ask members to agree formally that the Committee for Health has considered the Tobacco Retailer Fixed Penalty General Amendment Regulations NA 2021 and subject to the report of the Examiner of Statutory Rules, has no objection to the rule. Are we agreed? Yeah, thank you. And then the second one is in relation to the smoke-free premises and vehicles and the operators of vehicles. It's SR 2021/327. 1/332. I refer members to information at tab 16 of your pack. Have members any further issues they wish to raise in connection with this statutory rule? No, thank you, members then. So can I then ask members to agree formally that the Committee for Health has considered SR 2021/332, Smoke-Free Premises, Vehicle Operators and Penalty Notices Amendment Regulations NI 2021, and subject to the report of the Examiner of Statutory Rules, has no objection to the rule. Are we agreed? Yes, we're agreed. And I think that's, I want to thank members for the consideration at SL1 and SR stage. I think that is important legislation, and it's good to see that coming forward. So members, we're going to move on in the next session to Hospital Parking Charges Bill, but I want to just give a very quick comfort break to members. If we could come back at 12:10, please, members, so just a 5 or 6 minute break, and we'll come back at 12:10. Thank you. And Clerk, if you can just take us off the session.
Okay, Chair, that's back us on live again and ready to go.
Okay, thank you, Clerk. Able to hear and see me okay?
Yep, yeah.
Thank you. Okay, members, so we're picking up then at item 17, members, on our agenda. And this is in relation to the Hospital Parking Charges Bill. And we are taking evidence today from the Belfast and the South Eastern Trusts. Members, this is our first of our evidence sessions in relation to this bill. I refer members to the written submissions received from 2 of the trusts at tab 17.3 and 17.4 of the pack. Copies of the bill and EFM can be found at tabs 17.1 and 17.2. Clerk, can you just check with you that members can be brought up into the spotlight there, please? I'm only seeing yourself on screen at present.
Sorry, Chair. Yeah, we'll bring them up. We normally put them back down when officials come on, but yeah, they're all up there now.
Okay, well, sorry, okay. Also included, members, in the table papers at tab 17.3 is a written submission from Marie Curie. Are members content to the committee invite Marie Curie to the next evidence session on the bill? Yep, members content. Any members wish to declare an interest at this point? No. Okay, and then if you want to go ahead then back to the original, back to the audience setup, then I'll go ahead to the officials, Clerk. So I'm going first of all to the Belfast Trust, and we're joined by Brenda Craney, who is Executive Director of Nursing, User Experience and Allied Health Professionals. And very good to see you again, Brenda, and you're very welcome, and thank you for attending committee this afternoon. Can I just check that you're able to see and hear us okay? So we're not, would you just check your mute, Brenda? We didn't hear you there.
Apologies, we've been having some problems with the link today, so I'm on my phone. Can you hear me now?
Yes, hearing you and seeing you clearly there now, Brenda, so thank you very much for that. We're also joined by Jeff Thompson, who's Assistant Director within Patient Experience in the South Eastern Trust. You're welcome to our committee meeting, and thank you for attending. Jeff, and are you able to see and hear us okay?
Yes, I can see and hear you. Nice to meet you.
Yeah, you too, Jeff. And listen, thank you both for coming along today. We do have your written submissions, and we thank you for that. But in light of that, I would just ask you maybe to keep remarks as brief as possible, and then we'll go to members' questions. And again, if members can identify who they wish to answer a question, so be it. And if one individual can provide the substantive response, and we don't see duplication, it will help with the timing of the session. So thanks for that. So I'll go back to yourself first, just the order I have you here in my list. I'll go back to yourself, Brenda, and then to Jeff for brief opening remarks.
Okay, thank you very much. It's nice to meet everyone today. We have sent you, you'll be aware, quite a long paper about the challenges we're currently facing around car parking in the Belfast hospitals and across all of our sites. The first comment I would like to make is that our absolute priority is to ensure that, firstly, patients and their relatives have ready access to our services, and members will be aware that people come to the Belfast hospitals from all over Northern Ireland. Secondly, to ensure our staff have access to car parking in the trust, cover the 24 hours a day of our work, and that they're able to park as safely as possible. You will also see in our paper that we have a number of challenges across our sites, which are determined by our location in Belfast as well, given our city centre location of most of our sites and our proximity to other businesses. And finally, one of the challenges we have is maintenance and the equality of access to our car parks. We need to maintain our car parks and we need to ensure that they are safely run. So it has been a huge challenge for us to date. And certainly, whilst I understand the purpose of the bill is to ensure ready access to our sites, and we'll be supportive of whatever colleagues in the Assembly decide. Certainly, I'm also keen that members understand the challenges we would face in doing so. And but our priority is to ensure that patients and their families are able to come, because coming to a hospital or a clinic appointment is very stressful, and we want to make coming to our sites as stress-free as possible. Thank you.
Thank you, Brenda. And Jeff.
Okay, well, good morning. My name's Jeff Thompson. I'm the Assistant Director in the South Eastern Trust and have overall responsibility for the management of car parking and travel planning. I sit on a National Performance Advisory Group for car parking and travel planning and have 8 years' experience in managing car parks in the Trust. So I'd like to thank you for letting us have the opportunity to speak today. If you don't mind, it probably is going to take me just about 5 minutes to go through our issues.
Okay.
First of all, I'd like to say that the Trust I represent wishes to acknowledge that the subject of parking is a highly emotive issue that divides opinion. On one hand, car parking charges can be viewed as an oppressive tax on the most vulnerable in society and also an additional cost burden on our staff. But on the other hand, charging could also be said to provide a source of revenue that doesn't eat into health and social care funding. And we raise costs from income to cover associated car parking operations and maintenance. It also acts as a deterrent for inappropriate parking, as Brenda has said. In the paper submitted to the committee, the Trust has explained that staff with permit holding staff pay a concessionary rate for their parking, and on average 2/3 of our major hospital sites have dedicated spaces for staff parking, which is quite a large proportion of the total spaces. Everyone knows that when they attend hospital, it's quite a stressful time. It can be extremely stressful to attend an outpatient's appointment or receive ongoing or urgent treatment. And if our parking becomes free or unrestricted, our spaces will be filled first thing in the morning. And this will only add to the anxiety of the visit. And I suppose I just want to make it clear to the committee, there is simply not the space on our sites to provide parking for everyone. We believe the absence of parking controls and fees could disproportionately affect the most vulnerable in society from accessing healthcare. For example, those who absolutely require access to a parking space due to their mobility or their disability, or those that travel from a rural area without any choice but to use a car. Therefore, a full Rural Needs Act and equality screening of the proposal would need to take place if it hasn't already been done. The resulting displacement of public parking would in turn affect our local communities and further add to congestion in our surrounding neighbourhoods. The introduction of car parking controls, including charging across the Trust, was a significant strategic change to exercise control of our parking areas and followed an extensive period of public consultation and equality screening. And in 2014, at the time of the public consultation, the Trust had received correspondence from the Health and Safety Executive that raised concerns about the lack of vehicle and pedestrian separation on our sites, in part as a consequence of inconsiderate parking on pedestrian footpaths caused by not controlling parking on our sites. And the same concerns regarding patient safety were also received at the time by staff representatives and service users. It's therefore, in our opinion, reasonable to assume if the charges were to be dropped and controls removed, hospital car parking sites or hospital sites would be filled once again by staff and commuters early in the morning which was our experience before these controls were established, leading to delayed and missed appointments. And furthermore, if all the income from car parking is lost, it would lead to the closure of our free-to-use off-site staff parking locations, the termination of free-to-use staff park and ride schemes, the reduction in security presence on our sites, and the closure of our shop mobility services, all are funded through income, as well as the development of future travel planning initiatives. Can I just say to the committee, on a personal basis, when I was younger, I would never thought that I'd be responsible for implementing charges on hospital sites. It would never have fit comfortably with me. But if the overall objective of any health and social care organisation is to improve health and social well-being of the population, it's essential we take difficult choices and create viable alternatives to encourage more active and sustainable transport options for staff and visitors, and thereby contribute to the reduction of our CO2 emissions and vehicle particulate emissions. And the committee is aware that on the 3rd of February 2020, the executive declared a climate emergency. And we're also aware that there are 2 bills going through the executive as we speak. And 68% of respondents to the initial consultation agreed that Northern Ireland should reach a target of net zero emissions by 2050. But regardless of the bill, whichever one succeeds, we know the direction of travel. And as I've outlined, parking is extremely complex and an emotive issue that really needs to be carefully understood prior to any significant change. So on that basis, our trust believes such a change in legislation to prohibit charging for parking is actually counterintuitive towards improving equality of access to healthcare and would impact on our contribution towards tackling the climate emergency. Any large-scale changes to the current parking arrangements would require significant capital investment to continue to protect spaces for those we invite to our services, and that transition would take longer than the 6 months that's proposed in the bill. Now, I'm aware that the committee has discussed ANPR, which is not a tried and tested technology in health and social care, and it's not without its pitfalls, so it would require research. And the fact, I suppose, the committee is actually discussing the technology to mitigate the proposal actually acknowledges the limits of the proposal and the need for more time to develop a more progressive policy which addresses your legitimate concerns raised at the forum. So the Trust believes the most appropriate path to balance the competing demands is for the committee to direct the department to undertake a thorough review of the policy and not through the proposed legislation. Can I just say, as an arm's length body, we follow Department of Health policy, but we do it as a responsible organisation in the most fair manner possible within our span of control. And if given the opportunity, we would seek to work across the region and across departmental bodies to ensure fairness and equality concerns that have been raised are addressed and we fulfil our commitments towards net zero. And as with other trusts, we promote free parking for patients requiring ongoing treatment, for example, for chemotherapy and renal dialysis. However, we go further and we also exercise our discretion to offer free parking to relatives of long-stay patients. Likewise, travel expenses can be reclaimed by members of the public with low incomes or who are in receipt of income-based benefits. And we also believe there could be further exemptions developed for members of the public with hidden disabilities, and in particular persons requiring frequent access to addiction services and mental health services, which are often associated with areas of socio-economic deprivation and where a fee for parking may act as a deterrent. Now, as a responsible, compassionate organisation, we'll be taking those ideas forward.
Jeff, I'm going to come in there. Could you, because we're aware of many of the issues, so if you could just be as succinct as possible, please.
Yep, I'm nearly there. Look, in terms of trust staff parking, we use eligibility criteria so that we can assess demonstrable need of those who require on-site parking. But we also would recommend that other trusts also provide free off-site parking, which we do through the use of income derived from parking. And we also finally believe that there could be more to be done to provide our staff with concessionary travel and translink services, and urge much more cooperation between the Department for Infrastructure and the Department of Health to improve rural and urban connectivity, but also to use hospitals as transport hubs. So thank you. I know I spoke longer than you would like, but I wanted to make sure the committee was fully aware of our trust position.
Thanks, Jeff. Okay, and thank you both. So I suppose, first of all, in terms of some general comments around this, and the first one that jumps out to me right away is much larger places than here are already doing this on these islands. I mean, Cardiff are doing it. I think Edinburgh, potentially Glasgow. So that's the first thing. The second thing is to say that during the COVID pandemic, the trusts have repeatedly asked staff to come back in off leave to work shifts that needed covered. And they're going in, the first thing they do, they're coming off their much needed rest over the weekend, they're leaving their families, they're coming in to work in Belfast or elsewhere, and they're meeting a barrier and a charge to go to their job that we all need them to do so badly. The Minister had removed the charges, and clearly that was possible, and that was managed throughout that period of time. I did myself actually ask him in committee before Christmas to continue to extend that mitigation factor to staff, given that we still continue to put them under pressures that staff really shouldn't have been asked to. We came into a pandemic with a staff workforce that was already tired, already under resourced in terms of people and vacancies across the system. So that's that issue. The other thing that I have to say I'm hearing an awful lot of is what the problems would be if we simply did nothing. And I don't think that's what is appropriate in this situation. I think we should be more in the space of how would we address those issues. And I'm going to come on to ask you a number of questions around what you've been doing to address those issues for staff, on behalf of staff, and on behalf of the people, because I have at heart the interests of many of the same people that you have mentioned, Jeff and Brenda, staff, people with disabilities, and rural people who don't have access to a transport network. And those are all major issues that need to be resolved. However, I don't believe, I want to state very clearly, I don't believe that we should be pushing those fundamental structural inadequacies onto already hard-pressed, much-needed frontline health and social care staff, or indeed people with disabilities. So, for example, Jeff, you talked about managing the system. Surely it wouldn't be beyond the wit of people to look at a situation where you would supply passes, for example, that would allow you to control the parking. So I'm not content that we take this all, that you would just throw this open to the wind. First brief one, you had mentioned there, Jeff, that it would require significant capital investment, which could be more than 6 months. Has there been any engagement with the Department of Infrastructure or indeed the sponsor of this bill in relation to that issue that's causing you concern?
Okay, can I just take you up on a few points you've raised there? First of all, the issue of Cardiff. I'm not aware of Cardiff in Scotland, but I am aware of colleagues in England as I sit on a national performance advisory group. Their experience over the pandemic and since they stopped charging is that their car use rose and is now back to 2015 levels. So all the work they've done to try to improve and reduce single occupancy vehicle use has been unwound because of the current stance in England. In terms of removing controls during COVID, that was only possible because there was a downturn in services, which meant that less people were coming on site, and we had the capacity to deal with the additional staff that we could park on our sites. And in any case, the South Eastern Trust offers all staff on the Ulster site and Lagan Valley, and soon on the Ard site, with free off-site parking alternatives, which are either adjacent to or have park and ride schemes funded through car parking income. Policy is really the way forward with this. Like I said, it's going to take more than 6 months to implement this. No, I haven't had any engagement because the bill is currently going through. No one has approached me either in terms of the consultation that was put forward by the member and asked for our view on that. So that's why I really do appreciate being asked by the committee today. So no, that engagement hasn't, but I can tell you it would take longer than 6 months to put these measures in place. And the only way to do this is a comprehensive review of policy by the Department of Health, and any mitigations in terms of costs incurred are funded.
But yes, can we agree, Jeff, that Cardiff, for example, have clearly dealt with these issues and have managed to overcome them? So therefore,
I'm not aware of Cardiff. I can't speak about Cardiff.
Okay. Well, I can tell you that it is the case in Scotland. Scotland and Wales have both abolished charges, and it's making its way through the House of Commons at the present time, the same bill. So it's being done by a lot of other jurisdictions.
Yeah,
We've also heard. There's also been evidence. There's also been evidence in the course of the bill of cancer patients who are paying hundreds of pounds for parking services. And Brenda, I just want to go to you briefly for a second. My understanding is that the Belfast Trust are actually looking at raising charges, and this is in a way almost effectively what we're doing is creating a situation where staff are subsidising for lack of capacity that's in the system, and that staff are having to pick up the brunt of the cost via them paying for what is essentially a lack of capacity problem. So Brenda, your view in relation to the necessity, or why are you even considering at this time putting additional costs on frontline staff?
Colin, thank you. At the moment, we are required to charge for car parking within current policy. So I would like to say from the outset, if that policy were to change, then we will work with all of our partners to support and implement this policy. And I do understand where this is coming from. You know, we have had a very, very challenging 2 years, you'll all be fully aware of. And without our very loyal staff, we couldn't have got to this point. So it's really important we recognise the benefits of having free car parking over that period. However, from a practical point of view at the minute, we don't have enough space. The reason we're actually looking to streamline our charges, because if you park in the city, for example, you pay a lot less than if you park in the Royal or if you park in the Mater. So our purpose in doing that was in line with policy. And to stratify those charges. Now, we do index link our charges at the minute to people's whole-time equivalent and their salary, and we would continue to do that. But importantly for us, we need the people who need ready access to our car parks to have that access. That's our patients and their families, and then our staff.
Yeah, sorry for there's a wee delay on the line there, Brenda. Sorry for cutting across. So you said there's not enough spaces to provide free parking. How many spaces additional would be needed?
At the minute, we need about 1,500 spaces across the Belfast Trust and all of our sites. Now, the one thing I would say is if people who have ready access to public transport and to and work regular hours for our staff, if we got to a point where we had an access criteria that colleagues could agree to, and we're testing this at the minute, then we would free up a number of spaces. Similar to colleagues in South Eastern Trust, we also have park and ride facilities, which are not hugely used at the moment, and obviously they don't cover the 24 hours of the day requirement. But we are looking to our staff who work regular hours and live within those routes. But not everybody. I mean, we have people in Belfast who travel from Donegal to work with us. They travel from Derry. They travel from the North Coast. So we have to be practical and realistic, and that's the same for our patients and their families who access our services. And Colin, the other point I would like to make: people who come to Belfast for cancer services get free parking. And if they don't, I need to know about that, because certainly anyone who is having critical services or come regularly for chemotherapy or radiotherapy, they are entitled to and should get free car parking. Similarly, if anyone is in intensive care, or if a child is in the children's hospital, then members and guardians are entitled to free parking. So, you know, our issue is about space, and it is about our location. And the other point I am keen to make to committee members is that, you know, we are supportive of doing the right thing, but given the challenges we face, we need the support of Assembly colleagues and indeed the public to allow us to do the right thing, because no matter what way this bill goes, we simply do not have enough space on our large hospital sites. And, you know, so we need, for example, if we did a free car parking and everyone coming into Belfast for work chose to park in the Royal, the City and the Mater, then our patients and their families would not have enough space to park. And they're the hard conversations we need to have with our public.
Yeah, and I think everyone wants to do the right thing, and everyone would support doing the right thing, Brenda. But we are aware that, particularly in Belfast, staff members are paying up to £60 a week to park, and on minimum or living wage employees, that's not the right thing either. So clearly that.
Yeah, I would agree with you on that, Colin. And to get us to the point, we are asking staff who work regular hours, who have ready access to public transport, and Belfast hospitals, as you know, are very well served by public transport, that they would consider using that to allow their colleagues who work nights, weekends, you know, leave at all times of the day and night. And worryingly for me, and worryingly for all of us in the trust, we have staff who cannot afford to pay that, and they may park in areas and put their personal safety at risk. And I don't want that to be the case either.
Okay, and I do want to get to other members, but I just briefly want to check with both of you. Are there PFI contracts in place in either of your trusts in relation to parking? Is that a part of the equation here?
Not in Belfast. Our PFI contract on the Royal side was our only one, ended I think 2.5 to 3 years ago, and we now have those staff who work with us, so we have no PFIs for car parking.
And Jeff?
No, there's no PFIs. In fact, I think from my experience region-wide, there may be just the one associated with SWA, but that's the only one I can recall regionally.
Okay, thank you, Jeff. Okay, I want to go on to other members there, so I'll go to, at this point in time, I have indications from Paula, Deborah, Carol, Alan, and Jerry. So I'll go back to yourself, Paula. Go ahead, please.
Thank you, Chair, and thank you to Brenda and Jeff for coming along this morning. I'm not going to ignore what you've said in your oral or your written submissions. I very much take that on board, but I just have a couple of additional questions. And the first one is, have any of the trusts considered like revenue raising through other means? And I'm talking about like advertising hoarding, you know, with obviously strict guidelines of what can actually be advertised to raise some funds. The information that came out from the Belfast Trust there around the claims for the hospital travel cost scheme seemed to, within those 3 years of data provided, declined. Do you know why that was the case? Obviously, we were then moving into COVID, but I think that these 3 years were slightly before that. A wee bit of talk around how virtual online hospital appointments have sort of impacted on pressure for places. And then the other issue there is the new application and assessment process. If you can provide any more information on that, that would be great. Thank you. So I think that last one was for the Belfast Trust. Thank you.
Okay, thank you, Paul. Firstly, I'm sorry to say I don't know why the claims have declined, but I can look into that and come back to you. We haven't considered other ways of raising revenue, and that would not be within my expertise, but certainly that's something I could take back to. Our access criteria, which we note in our submission, we have worked on for probably 3 years now with trade union colleagues and with staff. And that is to apply a fair process in the context of the policy where we pay for car parking at the moment. As I said earlier, Paula, I do think we would still need a criteria for staff, irrespective of charging or not, because of our infrastructure and our lack of space. You'll be aware, both on the Royal site and the City Hospital site particularly, we have considerable redevelopment and building, which is actually reducing our availability to build car parks. We're also working with other people such as TransLink and, for example, on the Royal site, the Park Centre, to see if we could use the parking they have available. But the big challenge for us on those sites is then walking from places like the Park Centre or taking buses from the Park at Ryde. So we have to weigh up the safety of our staff particularly, and we're also keen that we prioritise patients and their family parking as well, because it is the right thing to do, and we want people to have ready access to clinic appointments and emergency care. But also, as you know, have a large number of staff who will meet that criteria, and as I said earlier, we're about 1,500 spaces short at the moment.
Sorry, there was one. Sorry, Jeff, go ahead.
I didn't know whether you wanted me to come back and answer some of those as well.
No, that's fine. You can. I think the other question was about the virtual appointments as well. I wanted to answer.
Yeah, go ahead, Brenda.
Sorry, Jeff. In relation to virtual appointments, we have virtual appointments quite well implemented across the Belfast Trust. But the one thing I am keen to say is that isn't suitable for everyone, and particularly our older population who use our services. They find that challenging, as you might imagine, and not everyone has a smartphone or access to a device. And secondly, sometimes a virtual appointment does not provide, the level of clinical assessment and review we require. So we are looking at a blended approach, but where possible, we are encouraging our staff to develop effective virtual appointments. I think that's the very important point. It needs to meet the needs of the patients first and foremost, and enable our clinicians to do an effective assessment.
Thank you.
Paula, can I just come back to you on advertising first of all? Yes, we have done some product placement in the past on our site. We were advertising some environmentally friendly vehicles. But would you believe it, because of COVID and the pressures on the car market actually at the moment, those car companies haven't got the spare capacity to place products on our sites, because the vehicles are in quite short demand, quite short supply at the moment. So we are looking at advertising hoardings, all in line with the ethics and the code of conduct of health and social care, what would permit us to advertise. Claims have declined. I wasn't sure and I didn't know about that. We'll look into it, but they are advertised on our website, what people are entitled to. Virtual meetings, consultations, yes, there has been a lot, but I suppose I would concur with Brenda that some of the elderly people might not like that technology, and we're, I suppose, in danger of viewing car parking capacity in the current climate of COVID, which is, I hope, a false climate, and we will return back to normal one day. So we can't overcommit to parking spaces, then to find in a year's time we needed them. So it's just not quite a good time to assess car parking capacity in general terms at the moment. Finally, I'd also like to just pick up something Brenda mentioned there about staff charging, whether we charge or not. And I think that's an important concept for the committee. The issue of public parking and charging is it acts as a deterrent, primarily on urban hospital sites. Staff charging, there is wriggle room there, certainly for staff charging, but if we went down a route where it was free, criteria would have to be used so that we make sure those staff who are most in need of a vehicle have on-site access, and we provide those free off-site spaces.
No, they're fair points, and just to clarify, I was talking about very much the link between the virtual appointments and the pressure for places, but I suppose in many ways you still have to continue to assess how effective they are. So no, I appreciate all the responses. Thank you.
Thank you, Paula. Deborah.
Sorry, it just took a wee while there to unmute. I just want to thank Jeff and Brenda for coming before the committee today, because it's really important for us to hear those, what could be the practical outworkings or otherwise on the ground, and you've both articulated those views very articulately. In terms of staff, I think maybe Jeff, this is one for you for the South Eastern Trust. I understand then from looking at what you've provided that there's 4,000 parking permits in the South Eastern Trust. Is there equality across the bands and the staff in terms of the South Eastern Trust, in terms of those parking permits? Do you have a breakdown of the profession and speciality of those staff? So that would be my first question.
Okay, Deborah, nice to meet you. I suppose, we are actually, where we've started to use eligibility criteria on the Ards and Lagan Valley Hospital sites, and where staff apply for their passes on those two sites, we are blind to staff's grade. So whilst we could try to establish or infer what band or grade they are, that isn't a factor when they're applying for their permit. It's whether they need it or not, based on criteria that's set. The Ulster is historical. It has people that park there which predates the use of criteria to get a pass. So if you can imagine, there's many thousands of people with passes on the Ulster Hospital site. To retrospectively go and then ask them to reapply might be problematic for us. So it's something we could do, but it's something really I think is not likely in the near future. So we're okay. Blind to staff grades is the answer.
Okay, and then as well, one of the questions is that I would have, is there a risk that because of certain maybe staff cohorts or patients and visitors already benefiting from concessions or free parking, that the bill would have a limited impact and instead grant maybe unjustified or disproportionate support to maybe people who do not have an evidence need? Or I think you've touched on this anyway, but commuters outside the health and social care system entirely. And then that maybe leads on to another question that I have, just that they talk about the benefit of the bill would be that it would avoid a postcode lottery in terms of free parking. So how this risk can be avoided under a VISE model that sees a continuation of hospital parking charges?
Okay, if there weren't any controls applied on our sites that currently have controls, all I can do is go back to where pre those controls took place. And on Lagan Valley Hospital, for instance, we were all aware of the market that occurred on a Tuesday morning when everyone filled up, come into our hospital site because it was free of charge, as opposed to paying a local, even a small rate. We are aware also of examples of commuters that use the Ards Hospital or the Ulster Hospital, and even on one occasion there was it was witnessed they went and got an aeroplane from the city airport and park and ride from the Ards Hospital. All these things happen, and it's probably more acute in Brenda's world in the Belfast Trust. We certainly feel the brunt of it more on the urban sites than the rural sites, where people fill up the parking spaces early. Now, those could be commuters, but also it could be the staff. So if there were lack of controls, the staff who come on earlier at the shift, it may be 7:30, 7 in the morning, would park on site before any public could arrive. There was a case recently. We have a multi-agency meeting forum over in Lagan Valley Hospital. It's chaired by an MLA actually, and it's attended by Sustrans, DFI, PSNI, TransLink. There was queuing forming on the Hillsborough Road. When we looked into it further, it was actually staff that weren't parking in the free to use off-site car parking that were paying for a public rate, filling up the public car park, and that caused then queuing down the road and on the Hillsborough Road and up to the junction outside the Lagan Valley Hospital. So we had to do some work improving the layout of the site to facilitate queuing to mitigate it. So sometimes, even though there are options of free options, staff still choose to park on site free and pay a public rate regardless of the alternatives. By introducing or having it free of charge, that will only exaggerate those problems.
Okay, thank you. Okay, Deborah?
Yeah, thank you for that. I was just wondering if that's the same with the Belfast Trust, or if there's any, differences there.
Hello, Deborah. Nice to meet you. At the moment, we don't have a huge problem with commuters using our sites. However, our rates, particularly in the city hospital, prevent that at the moment. Our concern is potentially if we had free car parking that people would avail of that, because as you know, you can walk to the city centre, within 15 minutes from either the city or the Royal, slightly longer from the Mater. So our concern is the potential impact if we don't have some sort of control. And the one thing I would say is in relation, we're a bit further along at the minute with our access criteria, and that is purely based on our hours of working and need to travel between sites during the working day, irrespective of profession.
Okay, thank you.
Thank you, Deborah. And moving on then to Carol. Go ahead, Carol, please.
Hello, Deborah and Jeff. I have to say, I find this quite shocking. Some of the examples that Jeff give are the complete opposite of my own experience in Belfast. But anyway, notwithstanding that, I mean, as MLAs who enjoy free car parking, okay, all day long, and even staff who use our building enjoy free car parking, I find that a bit bizarre at times that we're fairly well paid and we're begrudging low paid workers and indeed hard pressed families the availability to not be further penalised because they can't afford to pay for car parking. And for me and for us, that's where it is. It's cheaper to park in a well known shopping centre than what it is to park in the city, Brenda, and you know that, you've admitted that yourself. But again, I mean, consultants have a space. When you talked about possibly not being grade blind, a lot of consultants have free car parking spaces. Well, I certainly know on one of the sites in the Royal, they can drive in and it used to be their names, but their departments, there's a car parking space identified for them. And I was in the Royal 3 weeks ago. So if that hasn't been changed, then it should be. I'm concerned that the shop mobility has almost been used, the threat to the shop mobility, and the space has been used as a red flag or a red herring in relation to having free car parking. So I would like more examples of that. And Chair, I'll finish in this. Even in, and I'm going to point you to, I think it's 4.3 of your own evidence from the Belfast Trust. And it's clear to me that the car parking, so the Belfast Trust hasn't included in its budget operating costs for the car park, and it's relying on the charges to operate the car park. Now, I understand that's a current policy, but if this legislation was to go through, that's going to have to be thought out. So what discussions, if any, have been had on that? Thank you, Chair.
Thanks, Carol. Yeah, go ahead. I'll go first of all to Jeff there, and then briefly to Mo.
Okay, Carol, thank you very much. Consultants, no, all consultants where charges are applied on sites have to apply and pay the same rate as anyone else. Of course, the Department of Health policy currently says that it's based on their full-time or their or as a proportion of their income. So consultants are charged on our site, and there's no examples that I'm aware of any free consultant parking, none. In terms of shop mobility, look, it wasn't my intention to say, look, shop mobility would go. That's not my intention. My intention was to highlight that shop mobility is funded through car parking income. Likewise, there's several staff that provide a security service that is funded by car parking income. So there's difficult choices, and there needs to be some negotiations and dialogue to make sure that we have adequate funding to keep these services ongoing without affecting other types of patient-facing services. These are difficult choices that come as a result of the bill. There is one pot of money that's available to Health and Social Care Trust. Funding it through car parking and income is how we have traditionally paid for these services.
Chair, okay, so I'm not getting into pedantics here, but the inference was that if this bill was brought forward, shop mobility would. So I mean, that's the issue for us. And I mean, I just want to remind everyone that the trade unions, that the discussions that just have had thus far have been around for car parking. Trade unions and staff site representatives have raised these concerns for a number of years. Trade unions aren't opposed to this bill by any stretch. They've given us their submissions. They've spoken to different members. They're very much about free car parking at public hospital sites, and that's the intention of the bill sponsor. But in terms of us, I mean, basically what you're saying is, and again, go back to paragraph 4.3 of your evidence, you're basically saying that if free car parking is removed, then you're going to have to find another fund to operate the car park as it is, irrespective if this legislation goes through or not. I mean, you're basically saying this is how these services are currently funded.
Can I?
Yeah, go ahead, Brian, please.
Okay, thank you very much. Thank you, Carol. Firstly, can I just say I'm not aware of any areas in Belfast where consultants parked free of charge. So, Carol, if you'd like to advise me of that, I'll certainly look into that, because consultants, like all of our staff, go through the same access criteria. So I would like to assure colleagues of that. But if
Sorry,
you'd like,
Brenda, just to clarify, consultants have a space marked out for them, unlike any other member of staff.
okay, I think that may be a historical issue that we probably need to remove signage, Carol, but I'm very that, because that will not be the case if it is. In fact, we have actually removed car parking from a number of consultants recently with our design of services. So certainly I'm very happy to look at that. I think I might know where you're talking about, but I think that's historical. Does it say red badge holders by any chance?
It absolutely does, Brenda.
Oh, I know where you're
Go
talking
ahead.
about.
Yeah.
Okay. The other point I would like to make in relation to section 4.3, we were articulating that there is a cost to managing car parking, and at the moment, in line with policy, we use that income to manage the infrastructure, the staffing, the cash handling, and so on of our car parks. The one point I would like to make, though, if this bill goes through, certainly that is a consideration we need to have in relation to the management of our budget. And that would be a conversation we would have with our Department of Health colleagues, because we do need to have the funds to manage our car parks. And at the moment, they are running at a deficit. And the final point I would like to make in relation to shop mobility. Shop mobility is not dependent on car parking income in the Belfast Trust, and it's something we're very supportive on the sites where we've managed to implement shop mobility successfully. So certainly that would not be an issue for us in Belfast.
No, Chair, thank you. Thank you for that clarification, because the
I need to
Belfast...
move on, Chair. Thank you.
Yeah, I just want to make a point, Chair. It's very important.
Alan Chambers, go ahead, please.
Car parking charges are they're used in city centres for on-street parking and also in off-street parking. And the reason why the charge is there is not necessarily to make somebody a fortune, but to facilitate cars, movement for people not to stay long and hog a car parking space all there for a lengthy period. So that's the ethos of certainly charges on street. In terms of the hospital site, any scheme that was brought forward to allow staff to park free of charge, I would fully support, provided the logistics were there to support it. And that's what we can't just you can't just jump into a situation like this, much as we would like to facilitate it. But certainly, if any plan does come along to facilitate that, I'd fully support it. But we have to realise that a car park in a hospital site is not standalone. It's part of a process. It's part of a process of the hospital's operation. It facilitates staff to come into work and park safely. It facilitates families to come and visit their loved ones in hospital. But more importantly too, it facilitates people to come to attend outpatient clinics. And I know I've sat in a queue at the Royal with maybe 50 cars in front of me and thought I was in good time, maybe half an hour, 45 minutes before my appointed time, thinking I'll get in here and get a cup of coffee before I go to the clinic. But I'm sitting car number 50 in a queue waiting to get into the Royal and willing 49 or 50 cars to come out of that car park so that I might get in to be able to meet my outpatient appointment in a timely fashion. So my one single question really is, it's around the unintended consequences that if I think the officials here would acknowledge the car parking around the Royal Victoria Hospital and the Ulster can be absolutely chaotic at times. And I don't see a free car parking situation easing that. I think it's going to make it probably worse because of all the other reasons that we've heard stated. So can the officials tell me, is this could there be an unintended consequence of your outpatient operation being disrupted by so many patients not being able to arrive at their appointed time because of circumstances beyond their control?
Alan, it's Jeff here. Nice to meet you. Yes, that would be an unintended consequence. It is reasonably foreseeable to view that should car parks become unrestricted, then it would lead to delayed or missed appointments. That had been our experience before. Now, it may be marginally offset at the moment with the virtual consultations, but like I've explained, maybe some of those won't continue post-COVID, and our hospital sites are generally becoming busier environments. there's an ageing and growing population as well, and some of these visitors to our sites who attend appointments are becoming more reliant on vehicles to get to site, not part because there isn't the rural infrastructure to bring folk in on buses. And some of these people and a lot of the people don't have a choice and they need their vehicle. So anything that disrupts that equilibrium of car parking on site can very easily make a problem even more chaotic.
Thank you.
And might I add to that, please?
Yeah, go ahead, Brenda. Yeah.
Okay, thank you. Alan, hello, nice to see you again. Certainly, this would be our concern if we had unfettered access to car parks, the potential impact that this may have on our patients and their relatives. And, we are aware, interestingly, at the moment, we get large numbers of complaints about long waits and potential for missed appointments, but we have very few complaints from our service users about charging. And I think I've noted that in our evidence. But more importantly, whatever we decide to do going forward, we need the infrastructure and support, and we need to be able to prioritise the areas for our patients and their families and for our staff, because the majority of shifts, particularly for nurses and ancillary staff, start at 7:30. So if we have open access to all of the car parks, then those car parks will undoubtedly be filled. And obviously there's also the potential I referred to earlier that people commuting into Belfast may avail of that as well. So we do need a level of control and priority access for our service users and for our staff in different areas.
Okay, thank you, Alan. Thank you, Alan. And going into Jerry. Carol, go ahead, Jerry, please.
Thanks, Chair, and thanks for the presentations. Yeah, I agree that, parking charges are an extra tax on health workers, and they should be abolished, and I support the bill, as I've said before. And really what you have a situation is that health workers, particularly obviously in trusts and hospitals, are being blamed and charged for the lack of sufficient investment in public transport and the inadequacy of planning generally across our city. I mean, we have a situation in my constituency in West Belfast where large estates in the Springfield Road have no Sunday service, no public transport whatsoever. And these are multiple estates, big estates. And if you're working in the hospital and the Royal, you've done 12-hour shifts or longer, some people literally are unable to get public transport because it's not there. So I think the fact that those workers are being blamed and charged and fined, if you will, for that with parking charges is unacceptable. We also have a situation we've heard in evidence where some people have to get two buses to get to work, which obviously adds to time and creates all sorts of barriers for people as well. Situation, not to mention, if you get on public transport now, which I do, I'm a regular user of public transport, buses, gliders are crammed with people, which isn't safe for COVID, but also for people with other underlying conditions. And really this idea that we hear, I missed the start of Brenda's presentation, so apologies if Brenda didn't say this, but we've heard previously that people are parking in hospitals because it was free. I have no evidence of that, anecdotally or otherwise. I live right next to the Royal Victoria Hospital. My constituency office is right next to it. The biggest workplace is the Royal in West Belfast. That's where people are going. So if people are going to park in the Royal, where are they going to work? Why are they going there to avail of the free parking when it existed? So I just don't buy it, frankly, and to be upfront and honest. And also, it's just my understanding is the Department of Health, its staff has free parking, so why should it be one rule for the department staff and another for trust workers as well? So it's unfair, it's unjust, and I don't think the arguments around using environmental arguments to justify this regressive charge washes. Thanks.
Thank you. I'm not sure if there's an actual question, but Brenda, do you want to come in on that there, seeing you know?
Yeah, I will. Hello, Jerry. Nice to meet you. At the minute, we don't have evidence of people misusing our car parks to go into the centre of Belfast, but it is a concern if there was free and ready access to those car parks. So I know car parking charges are an emotive issue, but they have been our only method of control. So if there's another way we're able to control access for the right people, I agree. And you're quite right. You know, the Royal particularly is the biggest employer in Belfast. So we do have large numbers, 5,000 plus staff coming through every day. So you're absolutely right. But we're also 5 minutes walk from the city centre at most, which is a concern for us, but an unproven concern at the moment, admittedly.
Thanks, Brenda. Jared, I think that's important for us to appreciate Brenda's honesty, but there's no evidence. We've heard some trusts indicate that could be a knock-on effect, and Brenda's, confirmed that there's no evidence. I mean, and just finally, Chair, my experience in the constituency is that healthcare workers are actually parking in very narrow streets in communities because they, I don't blame them, but they can't afford the charges in hospitals. So it's actually the parking issue is in communities, and many feel that the trusts, the Belfast Trust in particular in this case, have ignored that. So I think it's an important clarification, Brenda, for the bill of the evidence today. Thank you.
Thank you. Yeah, thanks. Very briefly,
come back in that, and I agree with Jerry in that. I've put on record and noted my concerns about staff parking in areas that are not safe, and we need to have staff who work particularly out of hours, and obviously out of hours in the winters after 5 o'clock. We want our staff to be parking safely, and also the impact on communities as well, which is unfair whenever our staff are, utilising their streets, particularly around the Royal, the City and the Mater. Thank you.
Thank you. So moving on then to Pam Cameron. Go ahead, Pam, please.
Thank you, Chair. Thank you both to Jeff and Brenda for your attendance at the committee. It's really much appreciated, and we're here to listen to the evidence you have to give on this potential legislation. So we do appreciate your time today and all the evidence you've given today. And obviously it's not a straightforward issue, and I think from my point of view, car parking is incredibly unpopular. Nobody wants it, and I think what we want to see first and foremost is that staff are not treated differently in terms of postcode lottery, in terms of charges, and we know that varies across the province. And also I appreciate that patients who require to park at a reasonable distance from the health facility, that is vital important. So I think in an ideal world, we wouldn't have any car parking charges, but unfortunately we're not in an ideal world, and so we need to kind of look at the issues that this bill may bring in terms of practicality. So I do appreciate all of that. And Jeff, you did touch on the environmental aspect of this particular subject. So I wanted to ask you and Brenda whether you believe that the bill sends mixed messaging around the public sector's commitment to lowering emissions. I mean, it is a very important thing, and I know all the parties are greatly concerned, and we are looking at not one but two climate change bills currently. So it is an issue that has to be addressed, and I'm just wondering what you think about the messaging in terms of where we're going in terms of looking at climate change and looking towards those very substantial, challenging targets, and what way this bill impacts on that.
Pam, Brenda, do you mind if I go first?
No, that's fine. I'm just putting my power on, so no problem.
Okay, thanks, Pam. Nice to meet you. Pam, can you hear me okay?
I can indeed.
Lovely. Can I just, I think it's important when we're looking at future legislation that if we can, to look at staff and public as two separate entities, because there's two different approaches for those. And certainly with staff, like I've said earlier on, there are ways to minimise or even eliminate charges if there's controls on site. But in terms of public, there does need to be a deterrent there to prevent unauthorised parking and also to prevent the staff then parking in the public car parks. So that's important, that there are two strands to this problem and this solution. In terms of the public also, it's important that when the Department of Health, if they were to review the policy, that they look at all those vulnerable public patients, clients, visitors, and all their needs, and then reflect that in policy. As I've said earlier on, the policy as it stands at the moment does allow and actually instructs for exemptions and concessions for certain people with chemo and renal and people in critical care units. But it's silent on people with mental health conditions, addictions and things like that, and hidden disabilities. So I think there's more to be done from a policy development perspective on those other types of things where we could be and should be more compassionate. Going on to the environmental issues, yes, this is really key for us. And I think as a region, and I've lived here 30 years, I might sound like a blow-in, but I'm not. As a region, we need to do more to address our impact on the environment. We are aware, regardless of which bill goes through, we do need to cut our CO2 emissions, and we do need to address that. So car parking charges are inextricably linked to travel planning and sustainability and to the reduction of CO2 emissions for vehicle use, which is very high in Northern Ireland. I don't have the exact percentages, but it's higher than other regions of the UK and Ireland on our use of vehicles. So if we can do anything to nudge behaviour and encourage people to use alternative, more sustainable transport and even active transport, we'd not only be reducing the CO2, but we'd also be improving the health of the population we serve.
Okay, Brenda. Yeah, I know we lost you earlier there, Brenda, but did you want to come in?
I know, sorry, I'm back on again. Just to say, I don't think we can say it would be a cause, but it could be an unintended consequence of increasing car usage, as Jeff explained. And certainly, unlike other parts of the Derry or from Coleraine, then they're going to drive. But I do think we need to encourage our local citizens, if they can, to use public transport to reduce car journeys around the city. But for me, this is multifactorial. It's not just this bill, it's having joined up thinking and improvement of access to our sites and our clinics.
That's useful. Thank you, Brenda and Jeff, both.
Pam, sorry, do you mind if I just add to that? During the pandemic, DFI did operate free transport on TransLink services. And at the time, I did speak to the Department of Health and ask if they would open up negotiations or discussions with DFI on the extension. And I note that in the past, the Minister of Health has said that he would like to talk about the relationship with DFI and connectivity and the use of public transport for our staff and for the public. So I think if we are going to try and nudge behaviours, now is the time that those connections should be made, just like Brenda has said, and that need for cross-departmental working. If you if you gave concessionary travel or exemptions to all of the health and social care staff, that would not only show commitment towards a green agenda, it would also nudge other people's and their families' behaviour to do that as well.
I think that's a very valid point, Jeff. Thank you for that. I mean, it is a huge concern, and it has been touched upon, especially Brenda, you did touch upon it. You know, the safety of staff as well, especially working out of hours. You know, we all know people and have people within our families who are affected by that and who really are putting themselves at risk and putting themselves at a lot of extra cost as well while going to do their jobs and maybe travelling some distance as well, especially in terms of those staff who travelled during the worst of COVID into the Nightingale sites and maybe travelling quite a distance across the province to get there, and then still not being able to afford the car parking or couldn't access a space and were forced to take buses or walk long distances in the dark at incredibly unsociable hours. And really, given where we are in terms of recent murders that we've heard about, horrific murders, that there's a terrible fear there as well. So I think there's much more to be done especially in terms of that staffing issue. But I think we could be looking at more in terms of the environmental impact. So I think it's been really useful to hear your evidence today. So thank you.
Thank you. And Arlia, go ahead, please.
Yes, thanks very much, Chair, and thank you to Brenda and Jeff for coming along to committee today. So just maybe from the outset, I do want to say, I know the conversations that we're having and around the environmental aspect could bring, and of course many important conversations and initiatives that do need to be had around environmental issues, the CO2 emissions. But in the context of this bill and in the context of the ethos of this bill, I don't think that we should be pitching the CO2 emissions basically against what we're trying to do is ease financial pressure for our health and social care staff and our patients. And I do accept all of this is straightforward, and Jeff and Brenda, both of you have mentioned some of the problems that might come up and issues that need to be dealt with. But if I could just ask the question around, Jeff, you have mentioned that the implementation could take longer than 6 months to put some of these measures in place. But I mean, is that reason enough to oppose what's behind this bill? I don't think that the timeline should factor into that. The other thing as well, Jeff, I know it was raised around the examples of some of the other cities that have implemented this free parking scheme. And I would just like to ask then, do you accept that, the cities that we're talking about, like Glasgow and Cardiff, they're much, much larger cities than Belfast, they have much, much larger populations, and yet they have been able to resolve, I'm sure, a lot of the same issues and problems that we're speaking about today. So do you accept that it's a case that we actually can work through this for the benefit of our health and social care staff and for our patients? And what my biggest concern would be as well is that just as the conversation has sort of just furthered on today, and I am conscious that a lot of staff, unions and patients will be tuning into this health committee. In the consultation that went out, the public consultation, 98% of the respondents were in favour of this bill. So a lot of these people will be tuning in and will be listening to everything it says in the conversation today. And what my fear is, not finish on this, is that if the bill can't progress and if we can't get into a sort of solution mode of resolving some of the issues to get to the point of free car parking, it is going to create a disparity for patients here locally and for health and social care workers here locally. If it's ready in Cardiff, it's in Wales and Scotland, and then there's obviously that bill that's progressing through the House of Commons as well. So I'll leave it at that, and any feedback or commentary is much appreciated. Thanks very much.
Okay, well, nice to meet you. I know you said about the 6 months and how easy it would be, and why would we oppose it? Look, the reason why we're opposing it is because we believe that this will impact on the most vulnerable and on people from rural areas, particularly having uncontrolled access to car parks would lead, as we've already said, to those car parks being filled first thing in the morning by our staff. So it is really important to try to disentangle the staff side of things to the public side of things. There is an argument why we could be giving car parking spaces free for staff if we based it on their demonstrable need and provide them free off-site parking, which is what we do. So staff in the South Eastern Trust can park in the Omniplex at Dundonald and get a free bus across and back. On the Lagan Valley Hospital site, they can park at the overflow car park at the Leisureplex, which is only a 5-minute walk away. And on our site, we're in the middle of negotiations to acquire a site right next to the hospital, which will be free to use for staff. So we're talking about free to paying staff at the moment for on-site car parking. And we believe those staff should have a real necessity to use their car and have access to their car. For example, if they're a community nurse delivering direct patient care on a daily basis, that would be a very highly weighted criteria in our eligibility criteria we use. So whether it's free or not, I suppose is to me. I don't lead a policy. I follow Department of Health policy for staff. Is almost irrelevant as long as we got control of who can come on site and who takes priority to park there. Okay, so I'm not opposing the free thing. That's a Department of Health policy decision. The payment for the public is important in it to control the access, or else staff, like I say, will just park in the public space. In terms of Glasgow, I'm not aware of where you say there's no issues. My understanding, there has been issues in Glasgow, and that there have been problems with those car parks being filled first thing in the morning. So that's what I'm aware of. Now, whether they've ironed out or got through those, I don't know. And I suppose all of this stuff, the fact that you should treat public different to staff because of the reasons I've explained, because AMPR technology, which potentially could be used on some sites, isn't a proven technology, because we might need to look at different ways of doing things and have dialogue over funding. It just means that 6 month timeline that's proposed in the bill could be very, very tight and hard to achieve. So, and finally, the 98% on your consultation that was done, I acknowledge that. I would say, though, that in terms of its audience, we were never invited nor signposted to contribute towards that. So I don't know, and I'm not casting aspersions on how reflective that is of public opinion. It is a true statement, what you're saying, but does it reflect public opinion? I don't know.
Okay, Brenda, briefly, as you can, please.
I'll be very brief, Colin. Orlia, nice to meet you. I agree. We should be solution focused. Around the outcome of this, I think it's very important to listen to that 98%. That's a very powerful response, and certainly with any plans going forward, I think we need to walk into this, if the bill is passed, with our eyes open and work closely together across the agencies to do the right thing for our patients, their families and our staff, and to manage all of the potential implications, whether they're access or financial. But I hope you find our submission from Belfast, while setting that out, we will be supportive and collaborative and work with colleagues going forward.
Appreciate that. Thank you both.
Thank you, Orlia, and thank you both, Brenda and Jeff. So just briefly, Jeff, in relation to that consultation, that was a public consultation, quite open to everyone, including trusts, to take part in. So anyone that wanted to take part in that, it was open to them. I think the discussion largely boils down to clearly two key issues here: control and income. And I think, the question mark is around is how do you secure the control? And I think they're both important issues, by the way. Wouldn't dismiss either of them for a second. The question becomes, how do you achieve the control, and how do you secure the income, and who does it come from, and whether it's coming from staff or otherwise. I will just make the point that I also raised with the department officials before Christmas around the issue of bids within the monitoring round. And I think one of the things I pointed out that hadn't been applied for was any money to address that issue on parking. So there was a potential to bid for some money, and we are in the 3-year budget now. So I think that's something that should be borne in mind as well, because we heard directly in evidence from yourself, I think it was yourself, Jeff, or from one of the two of you certainly, that the income currently pays for the shop mobility and also for security. Yes, effectively, that could be interpreted as staff, or frontline staff, some on very low incomes, are paying for the security. Now, I know there's a difference of opinion, but that's one interpretation of it, and it's an important one. And I just want to read a small section of your submission, Brenda, in that context. And it says in your paper, the trusts want to reach a position where the income from car parking meets the cost of operating the car parks, and so is exploring options for increasing the current charges and or applying charges on other sites with 100 or more parking spaces, and or introduce charges on smaller sites where demand for parking exceeds the parking space available. Now, in the context of where we have all been out on doorsteps and streets clapping for workers and supporting workers, and all of that, the idea in that context of raising additional charges on workers, I think, is a difficulty in one sense in terms of the retention and the morale and all of that issues. And I agree that there are costs. It's a question of where those are funded from, and I think that's something that we need to consider. So I wonder, Brenda, I'll give you a chance to reply to that. Just I don't want to put that to you and then bring it to an end. But I'm just quoting from your own submission there.
Yeah, and Colm, I do think it's important to consider our submission in our current context, where it is policy that we do charge for car parking. Certainly, we, as I reported earlier, we do run at a deficit currently, so we need to fund our car parking arrangements in some fashion. That's how we do it at the moment, but certainly we'd be very open to look at other solutions. And the other issue for us around our car parking charges is to make sure there is equity, because our staff pay different rates on different sites, some of which is determined by the location of the site, and certainly there is a fairness issue here as well. So it is an emotive, challenging issue, and certainly we're very keen that we get the right solution that doesn't cause issues with access for both our patients and our staff. And I'm very committed to working with colleagues to do that in the right way.
Yeah, and I do think we fully understand and accept that you have the interest of staff, and we're not wouldn't for a second try to insinuate anything else. But it's a question of, and I think this is useful in that context. It's been a very useful session in the context of drilling into what the difficulties are, and that therefore then opens up the potential of looking at the resolutions rather than the difficulties. And we will be taking further evidence, hopefully from some of those other areas that have engaged in this, and maybe that'll be of use for everyone for information as we move forward. So I think that's useful, but I want to thank you both for attending our session today, for going through members' questions individually in the manner in which you have, and for providing your written evidence to us as well. So thank you, Brenda, thank you, Jeff, and take care.
Thank you. You're welcome. Thank you very much. Thank you.
Bye.
Thank you. Okay, members, I will move on there quite swiftly on to correspondence, because I'm aware members of meetings, I'm sure I need to get some a break in between and get some food in between their probably next meeting starting at 2 o'clock. So I'm going to move on to correspondence. And I want to draw members' attention to a couple of items there just within correspondence. First of all, item 18.3 is a correspondence from the Department regarding potential primary legislation the Department may progress in the next mandate. And I just want to say myself, before I take any comments from members, I am particularly pleased to see that adult safeguarding is up there, and maybe even more so, safe staffing is clearly at the top of that list that we have been provided. And I think that's a crucial piece of legislation. We have expressed, I think, in committee disappointment that it wasn't brought in this mandate, and I think therefore it's welcome to see it there. And I think the Health Committee will generally want to keep an eye on progress of both of those key areas. And there is clearly many other issues to be addressed and complex. There's nothing easy when it comes to health, but it's very welcome to see those two right up top of the department's list that they provided. Any other comments, members? Paula?
Chair, thank you. And that jumped out at me in the correspondence this week as well. I was delighted to see it. Certainly the minimum unit price of alcohol is something I've been watching closely. So no, I really appreciated that sort of forewarning that that's what's coming up for us in the next term. Thank you.
Pam, were you looking in or just nodding agreement there in general?
Chair, just to say yes, it's good to have this list in front of us, and it's heavy even for a full mandate. I'll say it'll be very, very heavy work going forward, but all very important, not least the minimum alcohol pricing issue as well. So yes, good to see that advance notice of what's to come.
Yeah, thank you, members. So members there for content to note. Correspondence? Yeah, thank you. Item 18.4 and 18.5 are department responses in relation to issues raised by fairness and fertility. Now, these are one of the issues, members, we all recall dealing with back quite some time ago and wrote to the department in the context of that time, and the response has been very, very slow in coming. In light of that, I think, members, should we seek an urgent update from the department in relation to how things sit currently and what the plans are around fairness and fertility and that very vexed issue, just to bring us right up to date? Would members be content we seek that? Yeah. There were a number of other issues responded to there very late, which again may be worth looking at again, but for now we'll move on in any case. Item 18.19 is correspondence from Michelle Gildernew MP, and just to very clearly state the interest that Michelle is my sister, as you all I'm sure will know. We have correspondence in from Michelle in relation to requesting the committee meet with the Human Milk Bank team in the Western Trust. I will also just, in further terms of declaring the interest, that I have on occasions met with the Trust in relation to that service. I think it's a really great service. It operates right across the island. It's the only place on the island that does operate it. And I have recently also spoke to members who have previously worked in that area. But do members have any comments, or would members be content that we put that onto our forward work programme and try to schedule that in along with some similar to the way we've talked about doing others, with a bit of a session to pick up on some of these issues? Pam.
Yeah, Chair, I mean, a great initiative, and I would love to hear more about it. I'm just worried yet again about the time that we have in committee and the pressure on us to actually continue our scrutiny of what's in front of us at the moment. I'm just wondering, maybe in the interim, would it be better maybe to have some kind of a written account on the issue and with a view to kind of placing us on a forward work programme. It might not even be for this mandate, but maybe for the next, because it is a really important subject. But I'm very aware that the pressure's on time, and I feel like, even witnesses today, I'm sure felt pressured, almost to stop talking, because we are very pressured for time, and I don't want to put any additional pressure on what we have in front of us right now.
Well, could we? I think it would be useful, certainly, even if we were able to squeeze it in at some point. Could we look at seeking the written? I think that is useful enough, and then we can leave it then with the clerk to see, is it possible, or is it what the impact would be? Would it fit in with some of the other things? Not rule that out entirely, but do take it under consideration as we go forward in conjunction with the clerk and committee staff. But we will seek the written update in any case. Yeah, thank you. Okay, members, in terms of table correspondence then, items 6.4 to 6.7 are from individuals in relation to oral evidence sessions on the abortion services safe access zones bills. Our members agreed that the committee respond to the individuals as discussed. Yeah, okay, thank you, members. At tab 18.2 of the table pack, there's a response from the department to questions raised during the briefing on January monitoring. You recall, I think that was just before Christmas time. Do members have any comments in relation to that monitoring session that we had? No, thank you. So members, then moving on to the forward work programme, do members have comments on any other issues of correspondence? No, thank you. Members then otherwise content to note as per the memo. So members, moving on to the forward work programme, I can advise that the committee team are currently drafting a forward work programme for the remaining weeks of the mandate. This will be included in next week's pack for consideration, so we can take a better look at that there. So members content? Thank you. And any other business then, members? No, thank you. Okay, members, so date, time and place of next meeting is Tuesday, 25th of January 2022 at 12:45 p.m. in room 30. Thank you, members, and take care. Or am I out?